Hi, thank you very much for having me on the show.
Jessica, tell us about this diabetes tsunami that Dr. Distiller is talking about here in Johannesburg that South Africa is facing.
Yeah, it really is a growing problem in South Africa, and we know that at least 1 in 10 adults are actually diagnosed with diabetes, but as you mentioned, far more are actually unaware that they are living with diabetes and they haven't yet been diagnosed. And it really is a growing problem and actually affecting more and more younger people in South Africa and putting these people at risk also for other conditions such as heart disease and strokes.
Jessica, let's first talk about how it affects the country before we talk about individuals. What are the long-term effects for South Africa if more and more people are getting diabetes?
Well, it definitely has a huge impact on not only the health system, but on the economy and the workforce. If these more and more people are getting diabetes, they might be becoming ill, being unable to work. That puts an impact on the workforce and on the economy of the country. There's also a really big burden with heart disease and stroke. And again, that is costing the country a lot of money in terms of healthcare. And then not to mention the impact that it actually has on the family and the loss of income in that particular family itself.
Jessica, World Diabetes Day, is it a successful campaign? And the numbers are quite staggering around the world. Is it having an effect?
Unfortunately, the numbers are staggering, that is correct. But I think having a World Diabetes Day, particularly a global health day like this, it's so important just to allow us to kind of take stock of where we are and what the trends are around diabetes. And then also to use this opportunity to raise awareness for the public around how to recognize diabetes, knowing the signs and symptoms, and then encouraging the public to go out and have their blood sugars tested so that they know if they are at risk for diabetes.
Diabetes, really, it's a disease that can be managed quite successfully, and a lot has to do with diet, really. What's your message as a dietitian to people out there who are sort of in fear of diabetes, and what have you seen happening in society of late that's a real threat?
Well, yes, as you said, it is definitely a condition that can be managed, and with controlling diabetes, a person can really live a long and healthy life, and they can prevent a lot of the complications. And in terms of diet, it's really about eating a healthy, balanced diet. So I know there are a lot of misconceptions out there that a diabetic has to eat a very special diet. It might be very expensive, but this isn't really the case. And it's just about eating a healthy, balanced diet, looking particularly at fiber and trying to increase the amount of fiber that we take in, which helps to regulate your blood sugar levels. Then limiting a lot of the unhealthy fats in the diet. And also what is really crucial is to look at weight, and particularly if a person is overweight or obese, to try and actually lose some of that weight. And in South Africa, that is an enormous problem. We know that a lot of women, 2 out of 3 women, and about 1 out of 3 men are actually overweight or obese. And so that is also something that we need to be working on, is trying to lose weight.
Jessica, why are more women than men overweight then?
It's a combination of genetics, also has a lot to do with sort of cultural and ethnic differences as well. Yeah, definitely a range of reasons. In certain cultures in South Africa, for a woman to have a larger body shape is actually viewed as her being beautiful. She's viewed as being healthy. Her husband takes care of her. So these are some of the issues that we are actually dealing with, and some of the sort of barriers that we need to overcome when we're educating the public on a healthy lifestyle.
That's a very good save there, Jessica. I want to take you back to one of your earlier comments. You said earlier that the alarming thing is more young people are becoming diabetic. Why is that, and how can we prevent it?
Well, I definitely think our lifestyle, plays a huge role. And in South Africa, with a lot more people adopting a typical Western lifestyle, we're seeing a lot of people who aren't exercising regularly. They're not active every day. We're being exposed to a lot of takeaways and very high fat and high sugar meals, a lot of meals that are very high in salt. And typically in South Africa, a lot of people don't eat a lot of fruits and vegetables as well. So, these lifestyle changes really are putting more and more people at risk.
Jessica, thank you for joining us this morning. It's a fantastic initiative, World Diabetes Day, and thank you for a very informative contribution.